Welcome back to Words of the Wise. Today I have Chief Birbeck from Olney PD in Texas, 27 years experience in law enforcement. I'm actually really looking forward to this conversation. We have some different topics for today and perspectives. So welcome to the show, Chief Birbeck. Thank you so much for being here.
Yeah, thank you for having me.
Of course. 27 years. Give us a little bit of background. How did you get started in law enforcement and what did those 27 years look like for you?
Well, it's kind of been a passion of mine ever since I was a little kid. Boy Scouts, military, and then obviously the next progression is into law enforcement. Started when I owned a security company in Dallas, but went through the police academy and then picked up a reserve commission to get started. And I kind of got tired of the security game and went full time into law enforcement in the Dallas Fort Worth area and spent a career there, and then retired and came out to a smaller community and took over as chief. In Dallas, I rose to the level of captain and oversaw a patrol and communications division that consisted of about 160 employees. And um, you know, in 2018, retired and came out to Young County, and eventually took over in 2020 here in Olney, and uh, here we are to today. So a lot of different roles, a lot of different experiences over the years.
Thank you. And I know you said that it's always been a passion of yours. Is there a particular why that has stuck with you throughout your career?
Well, I mean, initially, my biological mother suffered from mental health issues, which caused me to be in the foster system, which caused me to be in children's homes, and a lot of bouncing around and moving around. Uh, grab what you can and put it in the trash bag and go to the next place. And I went back and forth between my mother and foster care and children's homes and state hospitals and things like that. And really didn't see her get a lot of help. Um, and then becoming a police officer and then working in the Dallas area, I dealt with a tremendous amount of mental health issues, and it's just a huge gap in the need for mental health care. And it feels to me like mental health has been criminalized, um, as opposed to being addressed. And I know, the state of Texas backed off of inpatient mental health care many years ago, and it has had a devastating effect downstream in the criminal justice system. So, um, more specifically, when I got to Alney as the police chief in rural America, mental health care is almost non-existent, and um, law enforcement agencies struggle to get help to people, and ultimately, in many cases, they end up having to criminalize it just to get the person off the street, either to be safe for themselves or others. But obviously, putting a mentally um, a person with mental issues into a jail environment makes it even worse. And so that was kind of enough is enough. And then, I worked many suicides where people were crying for help and couldn't get it. And then there was one particular incident that really kind of sent me over the edge of, I'm going to start doing something. I'm going to start going to the Texas legislature, and I'm going to start really pushing hard for uh, funding to be able to provide some type of care for people that are really suffering.
I appreciate you sharing that with me. And when we talked offline, that wasn't something you shared. So thank you for being vulnerable and sharing your past experiences. Um, I can relate to some of the things that you talked about. Both of my parents were um, drug addicts and, growing up in um, not the best conditions. And I truly believe that our past experiences shape who we are, and it can be for good or for bad. And to me, all the things that I have been through, I had that choice of, um, you know, trying to help people or going down a different path. And I think now those past experiences that I've been through have become my superpower. And it sounds to me like those past experiences, although I can only imagine how incredibly challenging they were as a young child and young adult have now become your superpower to help other people. And so, again, I appreciate you sharing that. And
Mhm.
I don't know if, and you can tell me your perspective on this, but I don't know if we didn't go through those things, if we would have the same passion to help in the way that we do now.
You know, I would like to think that I would. Um, especially when I see the impacts that it has on families that I've dealt with for 2 decades, and whether it's doing death notifications or actually being the one to work scenes where I've worked, where people have taken their own lives and they're laying there with a no harm agreement to a mental health authority, and they didn't take them to get help when we, as law enforcement, were begging them to.
Yeah.
And so I would like to think that I would be as passionate, but I would tend to agree with you that I think that I have a different perspective, going through what I went through as a child, um, and then just seeing all the pain through the years. And, I empathize with people that are going through it. There's a lot of people that don't understand mental health, a lot of people that think it's a sham. Um, but I think statistics and um, everything bear out that it's not, and people are really struggling. And so, you know, I try to put myself in their shoes and think, well, if I was really going through something like that, it would really, I would really want somebody to be in my corner and try to help me. And whether that's internal or external, even as police officers, you know, people say that we have the best show, front row seat to the best show on earth. And I always say we have the front row seat to the worst show on earth, because we see things that nobody should have to see, and we experience things, and it affects, even the police officers' uh, psyche. And, so it's also important that we take care of them as well. Um, on our side of the table, because they get just as frustrated with the system, and where they're stuck even in their personal lives, and then also compounding that with everything that they're experiencing out in the field. So having some type of mechanism or way to address it, and to do a couple of different things: one, get people the help that they need, maintenance care, and then reduce recidivism. There are all these different components that come with just doing what's right.
Yeah. You said the word empathy, that you have this level of empathy for people who are struggling with mental health in the community. How do you teach that? One of the conversations that I've had recently is the challenge of teaching someone who's maybe earlier in their career who doesn't have experience, dealing with that type of population, or maybe doesn't come from a background where they understand it. How do you teach that empathy to someone who doesn't have the experience or that lived experience?
Well, for me, like I teach in the police academy now as well, so I'm getting these recruits that are not exposed to it yet, and I think a big portion of it has to do with preparing them for what they're going to be exposed to, and making them understand that, when I first became a police officer, there was not a lot of empathy, and it was pretty straightforward. It was, the facts and only the facts, and you know, you're going to comply or else. And I think whenever you set the expectation in the beginning as to what law enforcement officers are going to experience on the street, and it's not just about criminal law. It's not just about going out and finding bad guys and putting handcuffs on them. That is, if you're signing up just for that, you're going to be extremely disappointed in this career.
Mhm.
Now, I know that there's a place for that, and then there's a place that you have to understand that we're going into people's lives and crises, and we're seeing them on their worst day. And you have to think back to personal experiences when you had a bad day, whether you were told that you had a loved one that passed away, and where that took you mentally. um, you've had other experiences in your life where you felt out of control. Something was happening to you that you didn't like, and you had no control over it. And that's the same thing that these people are experiencing. And So you have to really set them up to understand that there are, you know, there's a joke out there that we're marriage counselors with guns. We're, you know, and I try to emphasize on we're peacekeepers. We're not just, black and white. We're going to do law enforcement. We're peacekeepers. And part of, keeping the peace is helping somebody find peace.
Yeah.
And, you know, there's more to it. And you have to be able to be aggressive when it's the right thing to do, and then not be aggressive when it's the right thing to do. And so I try to share that with them, and make it where it's on a personal level. Just think back to your worst day. Would you want somebody showing up being aggressive and uncaring and unsympathetic or empathetic or whatever, and making the situation worse? Or show some people some common courtesy and decency, and treat them the way that you would want a family member treated, and or your loved one if they experienced a crisis. And so those are just some of the ways that I kind of try to frame it for police officers, especially the ones that are really hard. Right? They put up this exterior wall of, you know just, I'm the law, that's it, and that's just not a very successful way to manage his career, in my personal opinion.
Yeah, no, I appreciate that approach. And I've never heard it put that way, that you're peacekeepers. And I really like that. I actually saw something recently on LinkedIn or something where someone was saying, it's not just law enforcement. When we say law enforcement, like the idea is that you are enforcing the law, and it's not like policing is so much more than just enforcing the law. And so I think that's exactly what you just said, in
Yeah.
your own unique way. And you said peacekeepers, and I know that you have a peace officer team.
Mhm.
What does that look like, and what has the effectiveness of that been for you guys?
Well, so I have developed mental health peace officer teams in the Metroplex. I don't currently have one, but that was the objective of petitioning legislation. Um, we went to Bexar County, which is San Antonio, Texas. They had a mental health peace officer team that was extremely effective. And, some of the objectives of those teams, they would include like a licensed mental health peace officer, and maybe a licensed clinical social worker. And you could have other components into that team where they're tracking data and statistics on the people that become consumers of that team. But the idea behind it is that you go out ahead of a problem, and you start visiting with mental health consumers that rise to needing attention from that particular team, and you go out and you build rapport with them. You go out and address crises, and you remove barriers to care. And so what that does is it reduces ER visits, it reduces recidivism, and it keeps these people stable. And I'll give you, for instance, you go out to a situation, and you check on one of your regular consumers, and they're telling you that they lost their job, their car got repossessed, and they weren't able to go to Walmart and pick up their prescription, and they haven't taken their prescription in a week. Well, obviously that's a problem, right? So we're problem solvers. So how do we fix that problem? Okay, well, we're going to go to Walmart, and we're going to pick up your prescription, and we're going to get you back on your medications. Then we're going to ask, have you ever thought about mail order pharmacy, right? And let's get you on mail order pharmacy. And if you don't have transportation, in our area, we have something called sharp line vans. It's a government assisted transportation. And if you qualify for it, and obviously if you're low income, you can't fix your car, you lost your job, it may take you $1 to go to Walmart to pick up your prescriptions, or to go to your appointment with the doctor to make sure, if you're needing counseling, visiting, and things like that. So it's just a way to remove barriers and provide support to a mental health consumer that they wouldn't otherwise get. And for like me here in Olney, I've got residents that need mental health care, and there's a bunch of different statistics out there. When we were looking at it, it was like conservatively 10% of your population needs some form of mental health care, right? Well, for me, that's a pretty significant number of people on a conservative side. And we are literally 25 miles from the closest mental health care.
Mm.
How do people that don't have any means, funds, transportation, any of that kind of stuff make that happen? So it's education, getting out there, making those contacts. And then tragically, aside from all the suicides and things that have occurred that we've worked, the last two law enforcement fatalities in my county alone were people experiencing some type of mental health crisis.
Mm.
And so how do we reduce, officer involved shootings with people that are having a mental health crisis? Well, if you have a mental health team that has developed a rapport, they know the person and that person knows that they can trust them,
Right.
right? And that's who responds and engages with that person and hopefully resolves it peacefully and actually gets them to where they need to be, which a lot of times is not jail. It's getting stabilized, getting medications, the medication regimen re-looked at to make sure that they're working like they're supposed to. I could talk all day about this, but so in rural Texas, we don't have that. And in a lot of cities that actually have the resources to do it, they don't do it.
Mm.
But because I don't have the resources, that was the reason I wrote a rider to Senate Bill 26 here in Texas asking for a budget to be able to fund one of those teams to purchase, the vehicles to do it. The officers would be dressed down so they're not aggressive. And we would start building that client list and start tracking data. And the bill actually got approved, and the rider was approved, and we were awarded $10 million. But when the Texas Department of State Health got a hold of it, they rewrote the grant, and they took peace officers out of it, and they made it stand up clinics where people would have to walk in.
Mm.
Well, here's the problem: we don't have enough providers in rural Texas to just stand up a clinic in Alney and think that it's going to be self-supporting, right?
Right.
And the other problem is that the worst of these people, mental health wise, are not going to get treatment voluntarily.
No.
So putting that team in front of them, encouraging them, all of those things make that difference, and making it accessible to them is the key to success. One of the other things that was a big issue with mental health in Texas when they defunded it, 30 years ago, is there's not enough inpatient mental health beds. And now the mental health dollars are so restricted that people that truly need help are screened out of actually going and getting a bed that they need. And they continue to compensate in the community until it becomes a problem. So my push in the legislature is that you need to fund mental health hospitals. You need to fund state hospitals. You can't pay mental health professionals what you pay regular RNs and doctors in a normal environment where they're not getting bit, hit, and spit. You got to incentivize those positions to get competent, qualified people in there to deal with people that are experiencing these mental health crises. And in Dallas, we were really fortunate because we had Parkland Hospital and other, intake hospitals in Dallas that you didn't have to go through a mental health authority. You took them to those hospitals. You did an emergency detention by the peace officer due to mental health and their danger to themselves and others. And they were automatically evaluated. And if they needed stabilizing care, they got it. But out here in rural Texas, we don't have that. And so that's why people are slipping through the cracks. So that's the whole purpose behind pulling these teams together, trying to get the funding to make it happen. And we're back at the drawing board again. I'm going to go back with a bigger, better argument this time for the state. I'm going to keep making them tell me no until I get it. And that's kind of where we're at. And I think we need the support of the community. I think we need people that have patients or mental health consumers that are not getting the care they need to really start blowing up their representatives' phones. And we have this huge surplus of cash in Texas that is sitting there. And what better? I mean, every law enforcement agency in Texas will tell you one of the number one issues that they're dealing with is mental health.
Yeah.
100%, right? Okay, crime, that's our Billywick, right? But mental health is the other number one driver of issues that we deal with. And so call your representatives, tell them to support mobile mental health teams because where they've been deployed, they've been extremely successful. They've reduced recidivism, so that saves money on the jail and criminal side, right? And they've reduced indigent care ER visits. So you have your safety net hospitals that are spending millions and millions of dollars on unfunded care. Well, we're reducing that burden on our local healthcare systems. It's a win-win all the way around. And for what? A couple of full-time employees and a car and some gas.
Yeah.
It's a no-brainer, and it just seems that that's the way government works. You can have a no-brainer, but there's so much red tape and politicalness to it. You can't get it done without a big fight.
Yeah. And that was going to be my next question, but you answered it for me is what's next? And it sounds to me like you're going to keep pushing and keep advocating for this. And,
Keep beating
I
the drum.
yeah, 100%. And I've heard that not just in Texas, I've heard this across the country that most of the calls for service are due to mental health crisis. And so everyone is seeing it across the board. And it sounds to me like the key is to build that trust.
Yep.
And so that was another one of my question marks that you answered. And I appreciate you being so thorough with everything because it helps to understand. But that was my question is like, how do you get people to trust in the system, to trust that they're going to get the help that they need? And to me, like you said, it does sound like a no-brainer. You have people on the street
Well,
that are actually caring about them and, getting them
yeah.
the things that they need.
Well, right now they don't call,
Yeah.
and they don't call because they don't trust, and it's because the mental health crisis stuff has been criminalized.
Yep.
They're looking for reasons to put them in jail as opposed to getting them help. But well, let me back off of that and just say the officer doesn't have the the resources to be able to get them the help that they need. So their only alternative to make
Sure.
other family members safe or neighbors safe or whatever is to criminalize it.
Yeah.
Our sheriff here said that over 50% of his jail population is in need of mental health care, and they do a tremendous amount of transports to to the mental health treatment centers here, and all of these folks are in jail suffering from mental health. They're not getting better,
Yeah.
right? And so I think again, you said it, it's a no-brainer, right? Why are we not addressing the root cause of the problem? We're
Right.
just using other things and band-aids and really saddling our sheriffs with this mental health crisis. And then we're shocked and surprised whenever we have bad outcomes in the jails. We have suicides or deaths in the jail or uses of force that people think that are avoidable. Well, until you walk a mile in a jailer's shoes, it's really hard to say that because people really don't understand the level of issues that people are dealing with. Most people look at people and think that they're dealing with people on a competent, normally operating level, and they're not. They're dealing with people that have, critical thinking problems, and they don't. What's the word I'm looking for? They're not able to make the same type of decisions as a rational person or a person that is not experiencing mental health issues would normally make. And so they measure it based on what they know a normal person is acting, not somebody that's in a mental health crisis. So I
Yeah.
think the whole point of the whole argument is they don't belong in the jail. They need to be getting mental health care. That will reduce use of force. That will reduce officer involved shootings. It will reduce recidivism. It will reduce emergency visits. It will reduce almost everything. Just getting them hooked up with the right care and maintenance, making sure that they stick with it. And we're the friendly face that comes around and make sure that that's happening.
Yeah. I heard this thing. I wanted to hear your opinion on this because I think everyone has different perceptions always and different perspectives on things. But I heard someone tell me that we don't have a homeless problem, we have a drug problem. And then I heard someone else say, we don't have a drug problem, we have a mental health problem. And they're using drugs as a way to cope with their mental health problems. What is your opinion on that?
I would tend to agree with that. I mean, um, a lot of the homelessness, and I dealt with the homelessness in Dallas up close and personal. We, my area was right on Harry Hines, where the Salvation Army homeless shelter is, and um, a lot of the people that are there that were out on the streets and not actually utilizing the services of the shelter had to do with mental health. They weren't able to follow the rules. They had those type of issues, right? And then they also were medicating with, you know, whether it was buying pills off of patients that were coming out of the hospital, to using, illegal street drugs.
Yeah.
It was compensating and taking, what it does is it relieves all the stuff that's going on in their head. It puts them into a different space. And, if you're really struggling and suffering with deep depression and all those things, you want to, escape that. So you use, the illegal narcotic. I mean, there are people out there that do recreational drugs and they do it for fun, and they're living their best life, I guess. But there are a lot of people that do medicate with illegal drugs. One of the biggest ones out here we deal with is methamphetamine
Yeah.
and heroin, and now we're obviously seeing the fentanyl,
Yeah.
and that obviously puts them in a different euphoric state that takes them away from life's problems.
Yeah.
And so, yeah, I think that we do have a mental health problem that drives a lot of the drug trade, and it's a cascading issue
Yeah.
that, and then you get into criminal activity to support the drug habit to escape the mental health, and it's cascading. It really is.
You're like basically describing my biological father and everything that you're saying. Like
Yeah.
he struggled with bipolar and he would always say, because he was addicted to methamphetamines, and he would always say that it made him more calm. And so then he kept doing it. And I don't know if that was actually the case. I think you were spot on with like the euphoria. But when he would come down is when he would go back into his bipolar tendencies.
Yeah.
And then it was that cycle that happened until he was homeless, living out of his van, and then he lost the van because he couldn't pay for the van and he wanted to sell it to buy drugs. And so it's this like cyclical thing that happens. And I agree with you. I don't think that it's always black and white, but it does seem to me that that is one of the challenges is people who don't have the resources, but also don't want to suffer. And so they're trying to figure out what they can do to reduce their suffering.
So even in my little town, um, I've had people that have done just the cycle you just talked about, and I'll go out and visit with them, and it's I even still get razzed a little bit by different people because they call them my projects, right? And I see these human beings living in cars, living in alleys, living in tents, and things like that. And at the end of the day, this is somebody's kid. This is somebody's. This is a human being, right? And
Someone's
yes, they
dad.
they they absolutely make poor decisions.
Mhm.
100% agree with that. But who's over there telling them what they can do to get out of where they're at? We had two that were here that went down that cycle. They had a place, they got evicted, they ended up in their car. The car, it got to be summertime. They had two dogs that they didn't want to get rid of. A lot of mental health stuff going on. They ended up in tents. We ended up having to run them off of, trespassing here, trespassing there. And we eventually had to criminalize it. And when we got the one of them in jail, I actually went to the jail and visited with this person, right, to try to implore them, beg them to change and to follow what we were recommending for them. And one of them did, the other one hasn't. But the other one that did it's such a success story because, I've watched her go get a job. And I was like willing to put my name on the line as the chief of police to go, please give this person a chance. If it blows up, you can blame me. Right. And now they're actually doing well. They have a relationship back with her mother, and it's just been a really blessing to watch. And then, so I've got several of those projects around my town that I'm keeping up with. And, they hit me on Messenger, and I'll talk to them at, midnight, 1 o'clock in the morning sometimes, and it's just letting them know that, hey, somebody actually cares. Right.
Well, that's what this is all about, right? Like that's what this, to me, this like human experience is all about, but especially in the individuals I meet, like yourself in law enforcement, like you entering into this career because you want to help people and you have this opportunity to truly change someone's life and you have examples of how you've done that within your community. I think that that's incredible and I would imagine so rewarding, and it's not meant to be like in a selfish way, but like how amazing is that to say I was able to get someone back on their feet and on the right track, and that's what this is about.
Well, when you circle it back to the question is, how do you train these new police officers or train officers to see this? I've actually invited some of these people that I've worked with to better themselves
Mm.
to the police academy to have open discussions with cadets.
I love that.
Right, so that they can question and answer, why did you make those decisions? Why, um, what drove you to do that? And they're hearing it from that person, and then that person gets to tell their story about how they got to where they're at, or where they were at, and then how they got out of it. And not trying to take any credit or anything like that, but they will always say that it comes with support from people that they never thought they would get support from, like a police chief or a police officer. Because some of my officers here, I have one of the best crews here, but they care about these folks, right? They'll hold them accountable, don't get me wrong, but they also care about them. And so we have a really good relationship with most of the people in our community that are willing to have a relationship with us, even though they're struggling.
I love that approach because I think a lot of times, and you can even make this into like a very simple example of maybe you are having a misunderstanding with like a partner or a friend, right? And you're sitting there saying like, help me understand how you got to this point because I only have my level of understanding. I only have my past experiences. And when someone can say, this is how I feel, this is what my thought process was, this is what I went through that led me here, then you can start to have that level of understanding, that level of empathy that we talked about before. Because I think without that communication of like, try to understand me, then you'll never understand anybody, right? Because we have like our one track minds based on, our previous experiences. So I absolutely love that approach. I also wanted to talk, and you mentioned this earlier about how this impacts the mental health of your officers, being out in the community. What are you seeing as far as how stress impacts performance? And what are some resources that maybe you are teaching or providing to help with the mental wellness of your team?
Yeah, so I mean, there are a lot of trauma informed care training out there that leadership can take. Your officers do, and again, it's a mentality that has been longstanding in law enforcement. Um, Old heads will say, "Suck it up, Buttercup." Get back to work. And but you look at the suicide rates in law enforcement and first responders that see all this horrific stuff. And again, if you're a data driven person, the numbers bear out. That's not a good approach. Police officers are human beings too.
Yeah.
Police officers are impacted by different things they see based on their life experience, whether it's a child fatality or a child pornography case or whatever. And it's really important that you attend to your officer's mental well-being. I've even like gone out of my way to make sure that officers that I see that are having issues with stuff get care, and that somebody's talking to them. I have a department chaplain that is really good at helping officers deal with the different stresses that come with this job. I think, as becoming a police officer, a first responder, a lot of times it becomes your identity.
Mm.
And you have a hard time turning it off. And that's why there's such a high divorce rate in law enforcement and first responder jobs, too. And I think it's really important because in my interviews, when I'm hiring new police officers, one of the most important questions that I ask a police officer in an interview or a police candidate in an interview is, what is your hobby?
Mm.
Right. And if they tell me, well, I like watching cops, and I go to classes to learn how to, and I'm like, no, 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 that's not going to work, right? That's not the type of officer that I'm interested in hiring, because they can't disassociate themselves with the job.
Mm.
And cops have a tendency to be on guard and on duty 24 hours a day. And I'm not going to sit here and be a hypocrite and say that, I'm not on point when I'm in a restaurant and, I walk in a door and I look to see who looks up, because those are the sheepdogs or the wolves. You
Yeah.
just have to figure out which one, right?
Mm.
But I'm the guy that looks up at the door every time the door opens. But at the same time, like, my de-stressor is Harley Davidson. I'm going to go to rallies. I'm going to go ride the back roads. As they say, live to ride and ride to eat, right? But it's something that, and I don't ride with other cops. And you've got and nothing against LE motorcycle groups and things like that. Everything, that's great. Camaraderie is great, all that kind of stuff. But me personally, when I want to go and decompress, I don't go do it around other cops. Like, I want to go with other business professionals and other people that have different perspectives on life. Because when you're around cops 24/7, all you get is cop,
Yep.
right? Stories, war stories, this, that, my department's doing this. Oh, these guys are horrible, whatever. And I would rather go listen to some guy that works at Lockheed Martin talk about the jet that they're fixing to build for the government, or, some other guy that is retired and living life and went somewhere on vacation with his wife. And, and it helps you to get away from this job, because if you make it your identity, especially if you go home and you're treating your spouse like a suspect, or thinking that she's going to follow orders like somebody on the street or whatever, you're going to get divorced.
Mm.
Your relationships are going to fail. Your relationships with your kids are going to fail. And unfortunately, with my kids, I've had to learn that the hard way, where I had to, like, back off, and it's not all about rigidness and, follow the rules or else, and that kind of thing. And so just teaching cadets and officers to have a good work-life balance
Yeah.
is key. And then just being trauma informed and aware as a leader, to look at the signs when people start getting angry easy. They're easy to anger. They start making comments. They start showing up late. They start dragging one call to the next call. That's a big one. And so for me, it's very important that officers, when they're done with a call, they don't drag it to the next call, because you have to go into each call with open mind and being objective, right? And if you're dragging your drama from the previous call to that call, then you're not giving those people a fair shot at whatever decision you have to make, right? So it's teaching them how to compartmentalize those things, and for us recognizing the signs, and for them recognizing the signs. If an officer needs mental health time, they need to come into my office or to their supervisor and go, "Hey, I need to take a couple of days off. I need to go do something else." And that's okay. And
Yeah.
then the biggest one is telling officers that if you're not okay, it's okay not to be okay. Let's get you some help. There are resources out there, whether it's my chaplain, counseling. uh, Texas Commission on Law Enforcement has counseling services available for police officers in Texas. It's all confidential, and these licensed professionals can give you other coping skills that, as a chief, I may not even have thought about. But um, I've noticed over the years, and supervising hundreds of employees, um, that you you're not really a good boss if you're not paying attention to your employees and what they're experiencing and how they're reacting to it. So I try to really watch for that.
I really appreciate the dual-sidedness of that though. So saying like, hey, as a leader, you have to look for the signs. I think as peers, you can also look for the signs within people. But then also having the flip to that and having the ability to have self-evaluation if
Hmm.
you need something, because it goes both ways. And to your point of what you said earlier, there might be people who don't feel comfortable or safe coming forward on their own. Whether
There's a big stigma.
oh, yeah, still. And I think
Yeah.
that obviously through these conversations, I think things are moving in a direction where it's becoming more normal, but I agree with you. I do think that it still exists. And so I think if you have both sides of it, if you have leadership and peers looking out, and feeling like there is safety to raise a hand if they see something, and then on the flip to it, creating that culture within the organization where if there is self-evaluation and you do feel like as an individual you need help, that you feel that safety to go to leadership and say, hey, like I need a day off, or hey, like I need to go talk to someone about this. Another thing I wanted to mention, because I I can only imagine how incredibly challenging it is to be in policing, in law enforcement, with all of the hats that you have to wear. You have to be a good partner, you have to be a good leader, you have to show up for your community, you have to be there as a husband, as a father, and don't take home work or home to work, and don't take work to home. And there's so many things that you have to juggle. And so, one of the things that I can just recommend to anybody, because I do think that shutting it off is easier said than done. And there are a lot of tools and resources that you can do to do this. But something that I have found to be successful, through feedback is one, do some sort of maybe breathing technique or visualization after you get off of work. So before you step into home, how can you take a moment to like ground yourself, maybe visualize yourself leaving work at work, maybe visualize yourself stepping through the door and being a really good partner, a really good dad, wife, mother.
Yeah.
And the other thing you can do, and this might be a little bit on the edge of like woo woo, so like bear with me, but it's really effective. If you have a piece of paper, or a notepad or something in your vehicle, and you do a dump, an offload dump. And so what that looks like is it doesn't have to be structured. It's not like journaling in a sense. It's just like write down everything that happened that shift, the good, the bad, the ugly. Write it all down, and the things that frustrated you, the things that you saw, all the things that might be stuck in your head when you walk in that door. Leave it on the paper, fold up that piece of paper, close the notepad, leave it. And then it's like your brain is like, it's indicating to your brain that like I am switching this off. I'm getting everything out that's stuck in there and I'm putting it over here. And then I can, and obviously it's not a perfect system, but
Well, I
it's
actually
helpful.
something that popped into my mind when you said that is light it on fire, and that way it's
Yeah,
yeah. I
100%.
kind of like that.
Light it on fire, throw it away, like do whatever you need to do. Yeah. And the flip can be that way too. Like if you are maybe having troubles at home, before you step into the station, maybe you have a moment where you do something like that, where you're like, I'm frustrated with all these things are going on, and I'm going to leave it there.
I'll tell you another one. I have on occasion been asked to speak at academy graduations as the speaker,
Mhm.
and every time I write a speech to go in front of academy graduates because all their family is there,
Yeah.
right? And I talk to the graduates and congratulations, you've come all this way and you're just beginning your all that stuff. And then I go, let me talk to the family now, right? And I think there's some education for families that can be done for law enforcement too, in that you know when a officer sees something that's extremely, or officer or EMT, paramedic, whatever, fireman sees something extremely traumatic that day, and they come home and they don't want to talk about it, and they need a little bit of space, and they're still trying to, you know, we just handled something really horrific here about a week ago. I mean, it was horrible and one of the worst ways to die I've ever seen. And I think about how that happened, and I was talking to my chaplain about it too, and he was struggling with it because he went there and he's our chaplain, right? So we were like taking care of each other, talking about this guy's last 10 seconds on Earth, right? And so when I talk to these academy classes and their families, I'm like, sometimes give them a little bit of space. If they don't want to answer questions, don't force them. Just give them some space to decompress and to manage through, because there are some things that you can write on a piece of paper and probably, my sergeant made me mad this day. He had this expectation, whatever, burn it on fire and it's gone. But
Yeah.
you see something like what we saw last week, and that's going to take a little bit longer.
Yeah.
And so just give them space, understand that they're dealing with some things that nobody should have to see, and be understanding of that. And then, also telling them to look for signs and symptoms and things like that. And if they feel like they need help, that they also need to reach out for their loved ones.
Yeah.
And so I think law enforcement and first responders could do a lot better job of finding ways to involve family into what they're experiencing, so that they have a better understanding. I think that would help the divorce rate situation and probably problems at home. And it would also help to identify that, he's not, or she's not just being difficult to deal with. Their mind is somewhere else, right? And it legitimately so. So I think, family training and expectations of what this career is going to bring into your life as a couple and as a family is also like it's important.
I think that's a great point. One of the things I heard that some organizations are doing to try to include the families more is creating almost like a Facebook group with all the spouses, so that it's almost like a peer support group for family members,
Yeah.
because it can be incredibly isolating for them too. And if you don't know if it's normal or what to do, but maybe you talk to someone who has been married to someone who's been in law enforcement for 25 years and has a different perspective of saying like, hey, this is what you can do, or like these are the things to look out for, and you have that community to talk to each other. I know that some agencies have found that to be successful too, of trying to give them more of that like peer support
Well,
together.
in Dallas, we started a peer program where when an officer came on board, you go through the FTO program, even if you're a lateral, it may be a condensed FTO, but um, I've always designed FTO programs as a not to try to catch you and fail you, but as to build you up and get you where we need you to be. And it just depends on the department you go to, because that's where they see if you're going to fit, right?
Sure.
And it can be very stressful. You go through 3 or 4 different trainers, and each one wants you to do something different, and it can get frustrating. So what we did is we developed a deal where somebody that's not an FTO, that's a neutral person, we introduced them and said, hey, if you have questions on how to manage a problem or something, and you don't want to ask your FTO because you're afraid it's going to end up on your DOR or something like that, you can go to this officer and it's confidential, and they can help you manage the stress of everything. And then you've developed a relationship and a friendship with somebody inside, right? So even beyond the FTO program, now you've got a friend and a colleague that you can go to and visit with. And so I think that was pretty successful, is because when you talk to the ones that were not just the officers that were getting those, but the officers that were providing that service, you get good feedback, right? Like, yeah, he came to me, he was talking to me about these issues. And you could also identify issues that you have in your FTO program that way too.
Yeah,
So,
100%. Like it's a little buddy system.
yeah.
I love that. I know we're butting up on time. I have one final question for you before we wrap for the day. What words of wisdom would you share with someone earlier in their career? Maybe something that you wish you would have known or something that's helped you along the way.
Well, I always joke and say, do what my dad said, be a fireman. Everybody loves firemen. But
Yeah.
I always also say, if not you, who,
Mm,
right? If not you, who? So again, understand that this job is just not about cutting straight law enforcement, going out there and slapping handcuffs on the bad guys and kicking down doors. there's a whole human component to this, and you're dealing with human beings out there, and not everybody's a criminal, but a lot of people need help. They need just the maybe it's just a words of wisdom. I've read the stories where an officer had conversations with somebody in a car to, about getting their life together, and they did. That motivated them, and they became a nurse or something, and then credited that conversation on the side of the road. Discretion is a huge piece of being a law enforcement officer, and sometimes just having a little discretion. I always say it's not always about the letter of the law; it's about the spirit of the law.
Mm.
And use your discretion wisely, and use your position not as a authoritarian, but as a peacekeeper and somebody that has the public's best interest at heart. The people of America allow us to police them. Um, they don't have to allow us to police them. We are there because they want us there.
Mm.
And if they don't want us there, I assure you, we won't be there. So treat your public like you would want your family treated, and I assure you, it'll come back to you 100-fold. Your community will take care of you, and I think in years past we kind of strayed from that mission a little bit, and I think we're pulling back in where we need to be, and demilitarizing our police and becoming community partners again. And that's how I police my city. Is I want to be a community partner, not a police state, and they appreciate it.
Thank you. Thank you
You're
for your
welcome.
time. I appreciate it so much. And, like I said at the intro, I was really excited to have this conversation. And I think that it's a lot of the topics were things that I haven't covered yet on the podcast. So I appreciate your perspectives. I appreciate your passion for helping those in need. And I really hope that, with you pushing and trying to push through this legislation that it'll return and work in your favor. So keep
Thank
going,
you.
keep going, fight the good fight, and thank you for your time and trusting me today.
Absolutely. And thank you for having me. And thank you for bringing up these topics and addressing them, and educating the public on, what we're actually dealing with out there. And hopefully all together as a team and voters and everybody, we can make a difference, and we can push some change that is actually going to benefit our communities. So
Yeah, and
hopefully we can get it done. I think we will.
I think so too. And it just goes back to what you said, if not you, then who? So anyone who's listening, like, a reminder that you have more power to make change than you think you do.
Amen.
Thank you so much.
All right. Thank you.